Well, good afternoon, everybody. Um, just kind of swung my tail around, and I'm getting this format. I'm over in the see half the pictures right here. What did I do? Get a new director of photography. This is nice. I like that framing. Just slightly off center. Looks like a TED talk now. Okay. Uh huh. Well, okay. So yeah, my name is Dennis. The whole nine yards. Yes, you know. I don't know. You may or may not have heard what had happened, but back in way back in. Last Thursday, not this last Thursday, 2 days ago, but last Thursday, 10, 9 days ago, I had to call up my stepmother Lou to come on down and grab me from my apartment because I couldn't feel half of my body. Uh, uh, and Following a full day in the ER unit, until later on that evening before I finally got a room up in ICU, and on to the next day before a full day in ICU before I got moved into my own room at the University of Iowa hospitals. Uh, that was way Friday night, late Friday night. And Since then, my subsequent release from the University of Iowa hospitals, and now at St. Luke's up on the sixth floor with their in-house or in-home rehabilitation. Because apparently, what has happened is I've had a stroke somewhere in here. I don't know, small section of my pinky, I guess, to a certain extent, pointed. I don't know. I don't know how far deep this way, but it's somewhere along this plane just above my ear, I suspect, but further in, like probably above my eye. It's close to the middle of uh, of the of the of the hemispheres of the hemisphere line between the two halves of the brain. Somewhere in here, but it's about this far back, like in my ear. Of dead tissue. That's where the bleeder that I had that Thursday morning that caused the left half of my body to basically fall asleep. That's what blew, and the subsequent what do I want to say? The subsequent things that happened after that is the fact that I've lost a lot of strength in the left hand part of my body. Things like my left arm is very weak. Feels like I have 50 pounds hanging from my arm right now, and it does take a lot of strength just to keep it propped up. Jumping it down. I've got mobility in my left hand, my left arm. My hand is not bad. It's not really able to deal out cards if I were to play some Uno, but I could probably still hold the remainder of the deck, although with some difficulty. Um, and along with the fact that I don't have any strength, I have to go to a lot of effort to make sure I plant my elbow in a spot that won't lose. Because I lose track of where my left hand is, it disappears on me. Because there again, you have some nerve endings running down this arm that I just no longer connected anymore. So I lose track. I lose track of it. I have to make sure that I keep all my arms in the vehicle, and I am in a wheelchair right now, to keep everything safe. This hand's fine, right? Everything on the right side of my body is doing fine. The left hand, not so much. And this takes a lot of effort just to now opening and closing it. Once I've got my elbow planted, this is not hard. It's odd. It feels like I've got a glove. It feels like I've got a glove on my hand. Is what it feels like, because I can feel the points, points in my hand and in my palm. But it feels like there's a layer in there, like a layer of yeah, of like a glove, nice leather glove. That's what it feels like. I mean, I still got the sensation on the top of the skin if I were to rub my fingers on it that I can feel, but it still feels like there's a glove on my hand. Actually, all of my left hand side has a slight dulled sensation. Um, like I've got half of a body condom just on my left hand side, and that includes some things like my face. It feels slightly dulled all the way up to here. Same side. Don't feel it here, but I feel it here. Um, yeah, it's a very weird sensation is what I find. But yeah, so that's what has happened since that stroke. So now I'm at St. Luke's getting some hands-on physical therapy, occupational therapy, and some speech therapy. Um, some of the notes and caption and some of the comments have been, "Well, you're keeping your sense of humor," and I was like, "That's the one thing that didn't go. All right, that did not disappear. Um, is my sense of humor, and to a certain extent, that's probably the one thing that's probably going to keep me going is a sense of humor." Um, yes, I take this serious. I take this very seriously. This injury and the circumstances with which it brought that brought me here. I take them very seriously. Um, but now that it's happened, I have to work with what I got. You know, got to work with it somehow. Find some harmony, I suppose. So, what has been going on today? Um, got up early this morning for breakfast. Didn't mean to. I think I got a little crick in the middle, lower end of my back. I think when I finally fell asleep last night. I say finally because it probably was half hour when my head hit the pillow, and a half hour before I was actually out. Um, I fell asleep and I don't think I moved. I don't think I moved at all. So my back was kind of complaining a little bit about being in one position all night long. So I got up a little early, for around 6, 7 o'clock. I was awake and already had my bed up, and I was propped up in a nice 40-degree angle watching cartoons, which is hey, that's what Saturdays are for, right? Of course they are. It should be a law. Um, and then breakfast rolled in, and oh, before then, morning rounds, and that's they basically take your blood pressure here in your room. They'll take your blood pressure, take your temperature, see how you're doing overnight, and then they'll make a second round to see if there's going to be any pills for you that morning, any medications, because when they do that first round, they'll go back and they'll make some notes, and there might be some notes based upon what had happened the day before. Go ahead, let's do this. So they're still upping my a new order for my lisinopril and metoprolol, and you got an aspirin, 325 milligram aspirin, some Prozac. They've got some of that for me as well. Anti-anxiety. They're saying that kind of thing actually helps post post stroke. Prozac may actually have some brain healing business that can help with. So that's relatively common for a stroke patient to have to take Prozac for a while. And what else? There's a handful of there's a few other things. It's a good hefty little package. Is what I get every morning. Um, and then yeah, so I got my morning pills, and then shortly after that, morning girl comes in and kind of helps get you dressed, get you up out of your bed and into, like, say, a wheelchair or one of the other chairs in the room. I chose for the wheelchair because it's a little more mobile, and I can, if there's something I need, or if my laptop needs to charge, it's not too hard. It's a lot more safer for me to stay seated and run over and glide over to a local outlet somewhere in here and plug that in, rather than try to do it while walking, um, which will be a topic here in just a moment. Um, and breakfast was good. Pancakes, maple syrup. Did make a mess out of myself. I did have to change out of my midnight scrub, or my overnight scrubs, and into some these clothes, because I basically ruined them with syrup. How'd you do that, you ask? Well, I'm glad you did ask, because it comes in a nice little plastic cup, the aluminum foil. trying to grab the little triangle tip and trying to open it. It's not opening very well for me. It's not opening well for me at all. So I decided to just kind of take it to this aside and took a knife to it and was going to try to cut through. Now, it's a butter knife. Not thinking really. Thunk. And then of course the size released on that top of that from the side from the tinfoil, so everything collapsed and went into the small container of syrup, and that plunger action basically just forced all this syrup to go, and it not only made it all over my pancakes, it also made it all over the front of my blue smock or my hospital smock or whatever you want to call it. So, I'm like, wow, covered in syrup. I'm like, well, don't want this to go away. So I grabbed a soup spoon. I just pouring it back onto the pancake. All of the remaining syrup back onto my pancakes. Then, and then just went, well, I think we're going to change clothes right after we get done eating breakfast, which is what we did. Yes. So here I am, fully cleaned. Post syrup geyser. Did a bunch of so physical therapy today consisted of a lot of walking, without a cane, without a wheelchair, without any assistance, which is entirely what I would say is entirely frightening, especially if you don't have a lot of control over a limb. You're relying a lot on memory and just, I think this is how I did this. So we did that did a couple about 4 passes on the gym floor, just trying to get that feeling of how to walk. Because my left leg's not completely dead. Okay, it does feel at times like it is a dead weight, but it's not entirely dead. There's some nerve endings running to some pieces, even all the way down to my left foot, where I can actually lift up my foot with a lot of effort and try to figure out how to thin that out, point it out, and try to figure out how to bring that back up, because that is kind of the physics of walking. And we made a handful of passes. Seems okay, at least for now. There's definitely some more exercises to learn how to lift that foot up. It still feels like, again, 50 pounds of weight just loosely hanging off the ends of my limbs, whether it's my arms or my legs. It's an odd feeling. It's really hard to describe. So I exhausted myself on the walking, and then just about 15 minutes ago, just came down and finally got done with physical therapy, sat down, and I actually had a little bit of sweat from all of that, and some good ideas about it'll be something we're going to continue working on in the future. I hope a lot more, because I would really like to be able to walk reasonably. I kind of have to relearn how to ride what I called riding the knee, the top of the knee, the point where you're not hyperextending it, or falling back, or locking it, and falling back on it. If you lock it and fall back on it, that's what happens with a lot of the military. They press one of those arteries in around the knee, and they pass out and falls, in formation. But yeah, trying to ride the top of that knee and keep the knee soft, so it's and I can feel some of that, which is bodes well, I guess, as far as my physical therapy instructor was telling me. He's like, that's a good sign. Work on that. We should be able to get you up and walking. He said, I don't think. Basically, the idea is shouldn't end up permanently in a wheelchair. There really shouldn't be. There should be no reason for that to happen. And maybe the use of a cane or something like that, just for balance and the whole 9 yards. That might be appropriate, but I don't. He's like, I don't think a wheelchair is something that's going to be for you in the future. I just don't. You know, it's kind of tentative still at this point. But he's like, right, how you doing right now? I was like, I just don't see that, which I was very happy to hear. Not that a wheelchair is a terrible thing. I mean, that'd be awesome. I mean, okay, I'm sure. I just have to learn how to keep my left hand inside the vehicle, as it'd be flying away. I'll probably, swap by some wall and just complete rash, not even feel it. So I had to be very careful with my left arm. Keep it in the vehicle at all times, and a seatbelt too. These wheelchairs don't come with seatbelts. It's kind of unfortunate. Anyway, that's it for today. Yes, I am in good spirits. Thank you for all. Oh, and comments and things like this. Don't try. Number one, try not to read too much in what I'm saying here. Okay, a lot of this stuff here is really for me for self-documentation and for my family to understand where I'm at any given point in time. Try not to take too much offense or take whatever I'm saying and think somehow that I don't appreciate what my nurses and staff are telling me. That is not even close to being the case. Don't think for a moment that I don't appreciate their assistance in everything that's happening to me right now, because I am glad for them all of the time. They work very hard, and every single one of them loves their job. All right. So please don't get that impression. And yeah, all the thanks and kudos, good luck, and I hope all of you are doing equally as are doing just as well. Okay. This is Dennis signing off for now. Everyone, family, friends, family, love you. Mwah. Jared and Haley. Mwah. Y'all take care of yourselves, okay? Hope to see you around when I get out of here. That'd make me happy. All right. Bye for now.